All right, so this is Telly or Telly Cares. My name is Annie. So picture this. I'm working abroad, sipping on some bad coffee. I'm sorry, I'm having trouble with the clicker. Can we?
We saw the image, so we get it.
I know.
Yeah, maybe.
Okay, I'll just ask for next slide. I'm sipping on my some bad coffee when the phone buzzes. Grandma is in the ER. Immediately, my heart sinks, and I call my dad, the primary caregiver, and he's not responding. Hours later, I find out my grandma had fallen, and a relative who wasn't involved in her daily care found her, took her to a new hospital, and because she didn't have any of the daily information, crucial care was delayed, creating more stress to an already stressful situation. But like 50 million families, we're using fragmented tools of notebooks, sticky notes, group text medication trackers, and ultimately, this was just not it. Eldercare today is stressful, inefficient, and so expensive. With a rapidly aging population, families are feeling burnt out, juggling careers, kids, caregiving on top of that, and the result is 45 billion in avoidable hospitalizations directly caused by poor care coordination. So clearly, family caregivers are not getting the support that they need. "92% of elder care happens right at home, whether it be for reasons of culture, costs, or safety. We do it because nobody knows grandma like family does. So let's go ahead and give families the tools they actually need to succeed. And that's why we created Telly, to replace chaos with clarity so that you can finally reclaim elder care and peace of mind. Telly is an all-in-one toolkit for families to deliver quality care right at home. And here's how it works. As a proactive care manager, Telly's ecosystem is simplifying care coordination and bringing quality continuity of care right at home. Our shared care journal tracks daily activities and transforms them into insights and flags. It flags potential health risks. So Telly is able to identify changes in caregiving trends so that we can even predict falls and intervene before it happens. So if my family had Telly, we would have been notified of how a medication change had increased the chance of falling. As you can see, the slides are auto-advancing. Telly's predictive analytics helps families stay proactive, connected, and prepared. Studies show that social support improves health outcomes. So our collaboration tools like senior-friendly one-step video calling ensures grandma can stay digitally connected with family, even those abroad, and families have access to remote check-ins to ensure grandma is safe. So we've looked at the whole care ecosystem, and frankly, Telly is going to benefit the entire care ecosystem. Doctors have access to reliable home care data. Insurance payers can reduce costs from reduced hospitalizations, and employers improve their bottom line from reduced absenteeism. Of course, our market is massive. The US spends $1.5 trillion alone on elder care related costs. And with just 1% market penetration in the caregiving solutions SAM, we're looking at a sum of $3.5 billion. Of course, competitors have taken notice of the size of the in-home care space, but they focus on third-party caregiving marketplaces, which overlooks the 92% of families who are managing care at home. Our actionable care insights and our full family engagement model differentiates us from the competition. Our revenue strategy is focusing on direct pay families, evolves from direct pay families for early adoption and organic growth to employer and payer contracts for scalability. Years 1 to 2 focus on strong initial feedback and marketing, and by year 3, employer and payer revenue drives high growth conversion. By year 5, we're looking at a 5 million ARR. Our traction is proving the need for Telly, with 4 partnerships with senior centers and caregiving services, grant funding from Columbia Business School, as well as $200K Antler VC offer, as well as acceptance into Berkeley Skydeck. What's next is that our MVP is currently underway, and in Q1, we're focusing on launching our MVP, testing, and getting our first paid customer. By 2026, we will have secured 150K ARR. Now, our team knows these pain points because we've experienced it. I'm Annie, a Columbia MBA student with digital health transformation experience at Epic, ZS, as well as my own consultancy. My CTO, Catherine, is a engineer as well as someone who's graduated from Cal, worked at Salesforce, Deloitte, and Shopify. My CMO, Young-Eun Kim, is the Chief Medical Officer, a student at Columbia Mailman School of Public Health, and is a case manager at Aetna and CVS Health. Our advisory team is very experienced in the geriatric care space, as well as in the caregiving digital health investments. So at this time, we're looking for 500K in pre-seed funds in a safe form to hit our milestones of launching our MVP, testing at scale, as well as growing our technical team, ultimately to get that 150 ARR. So please join us in healthcare that is accessible and inclusive at every stage of life. Thank you.
All right, well done. So questions for Telly? There's one. There's 2.